Dr. Nate Smith, Director of the Arkansas Department of Health. I'd like to speak against this bill. I do understand the importance of choice, particularly for local communities, but choices have consequences, and I want to talk for a moment about the consequences. Community water fluoridation, you've already heard what that is. It's adjusting the level of a naturally occurring element to the optimal level for good oral health. We have over 70 years of experience demonstrating its safety and effectiveness. In communities that do not fluoridate and have levels of naturally occurring fluoride that are below that optimal level, the likelihood of cavities in children are at least 30% higher. In Arkansas, when we compared two communities, one that had community fluoridation and one that didn't, we saw twice as many cavities among children as opposed to the community that did fluoridate. In a study in Louisiana in 1999, they found that in low-income children in communities without fluoridated water, they were 3 times as likely to need dental treatment in a hospital operating room. Those are the most severe cases, the most expensive cases. When you're talking low-income children, you're talking about primarily Medicaid as the payer. You've already heard that for every $1 that's invested in community water fluoridation, it saves $38. In this case, the $1 is to the water system. The $38 is largely to either taxpayer in the form of Medicaid or towards those who have health insurance in terms of private health insurance. So it's choices that have consequences, choices at a local level that have consequences for all the taxpayers in the state. But I'm most concerned about the children who don't have easy access to dental care, because for them the consequences are pain and suffering, lowered school performance, and basically just children hurting and suffering unnecessarily. Now, you've heard about the safety and effectiveness of community water fluoridation. Despite a lot of stuff that's out there on the internet, there's really no scientific debate on this amongst mainstream scientists, dentists, or public health professionals. But in many of our communities, there are generally very vocal minorities that have been influenced by what I would call false claims about fluoridation. Could also call it fake science. And those individuals can mount campaigns, and if a community were to stop fluoridating, then the people who would actually suffer the most from it are children. Community water fluoridation benefits people throughout the stages of life, whether they're adults or children. As long as you have teeth, you benefit from optimal levels of fluoride in your water. But it's the children who end up suffering the most in terms of pain, unnecessary suffering. Again, I want you to consider the consequences of this bill. Again, I'm all for choice, but choices have consequences, and these are very real consequences, especially for low-income children in our state. Thank you. If there are any questions, I'd be happy to answer them.